So good afternoon. We just had a chance, Lieutenant Governor and I, to walk through this 94-bed facility that was set up by Mike Lau and the folks from Cape Cod Healthcare, along with General O'Keefe and General Lau from the from the National Guard. Where is he? There he is. And I just want to say, first of all, when I said this to General O'Keefe on my way in, we are all incredibly grateful for the work that's been done by the National Guard across the Commonwealth since the beginning of this outbreak. When you call, they come, and they have been on the scene in a whole series of typical and many atypical scenarios and projects and missions since this all began, and I can't say enough good things about the work that they've been doing. The facility itself looks a lot like the field hospital that we toured at the DCU Center, and very similar to the one that I had a chance to take a look at the BCEC. And I say that because one of the things that makes this possible is the number of times that the Guard and FEMA and MEMA have worked to put these kinds of facilities up, not just here in Massachusetts, but all over the country and around the world. And it makes them very good at it. And this thing went from nothing to what it is now, fully outfitted and ready to go, 94-bed facility in about 6 days. Is that about right?
That's correct.
And Mike's also a terrific leader. We've talked a lot about testing. We've talked about how important that is. I do want to give you some updates on this. We think testing is a big part of identifying people who are dealing with COVID-19, but it's also part of then recognizing and identifying the people they've had close contact with, which is why we're working on putting up what I think will be one of the largest contact tracing programs anywhere in the country, because in the end, testing and tracing are a big part of how we actually push back over time against COVID-19. We continue to make a lot of progress on testing. You know, depending upon whose data you look at, we're either the third or fourth largest tester in the country, which is quite an accomplishment since we're certainly not the third or fourth largest state in the country. And we continue to make progress. As of yesterday, we've conducted about 122,000 tests, including 5,319 tests that were conducted yesterday alone. And we're now conducting testing at 28 sites statewide. And we continue to get more nimble and more creative with our testing as we go, as we talk to our colleagues in the healthcare community, and as we create new and different options to ensure that we're testing in the right places. Thanks to a lot of hard work and collaboration, we're now offering testing through mobile test units at nursing homes that's supported by the National Guard, at assisted living residents and Department of Developmental Services group homes, including the Rentham and Hogan sites, at Gillette Stadium and at the Big E for first responders, grocery store workers, and others, and at a CVS test site in Lowell where the public can make an appointment online. That's a rapid test system there, can do up to 1,000 a day. And through mobile test kits that are supplied directly to long-term care facilities that have the capacity to actually do the tests on site so that they can do their own testing quickly. And we'll keep working to expand our testing capacity for more residents, especially in communities that have had severe outbreaks like Chelsea, where over the course of the weekend, we expanded our testing by 4x. We continue to chase down PPE wherever we can, and through our COVID Command Center, over 3.3 million pieces of personal protective equipment have been distributed to hospitals, nursing homes, community health centers, public safety personnel, local boards of health, and state agencies. And that includes nearly 2 million gloves, over 720,000 masks, over 365,000 masks from the aircraft delivery, and over 167,000 gowns. Starting Sunday, the Command Center has started posting a daily inventory of PPE, sorted by types, and where it's been distributed around the state. This will provide a regular update on where our PPE is going, what types of supplies are in use by our first responders and frontline healthcare workers as we continue to navigate this pandemic. As everybody knows, we've also been modeling where and when we think the Commonwealth should expect to see a surge in cases, which has helped us put together our projections on how many beds we expect to need and where they need to be located. Secretary Sutters and our COVID Command Center have been working closely with the hospital community, some cases every day, throughout Massachusetts to understand their capacity and at the same time also what's going on day to day there. And they're now posting a daily dashboard to update the public on hospital capacity around the state. This will be posted starting today at about 4 p.m. It will include an estimated inventory of how many beds, hospital beds are available and where, including ICU, acute, and field hospital beds. For hospital capacity as of Sunday night, we're up to about 15,900 usable beds statewide. Roughly 5,000 of those beds are available for non-ICU or acute care. Roughly 2,000 of those beds are available for ICU care, and nearly 1,000 beds are available in our field hospitals for patients who need it. In short, we have about half of our beds available statewide right now for different levels of care. As part of our strategy to increase bed capacity in all corners of the Commonwealth, we've been pursuing the construction of 5 field medical hospitals in different regions. The beds in these facilities will serve as an alternative care option for medical professionals to treat patients, especially those who need less intensive care. Each field hospital has a local healthcare partner, and that's why we're here today with Mike Lau and the folks from Cape Cod Healthcare, because they are the partner and sort of the lead dog on this site. Cape Cod Hospital has been a terrific player and a terrific partner in this, and Mike will have an opportunity to speak in more detail about the work they've done in a minute. The Lieutenant Governor and I have toured the hospital at the DCU Center in Worcester, which opened its doors to patients last week. I took a walk through the BCEC last week, and they started accepting patients last Friday. We're also on track to open 2 additional field hospitals, one in the Merrimack Valley and one on the South Coast. In Lowell, we're in the process of opening up a field hospital at the UMass Lowell Recreation Center in partnership with Lowell General Hospital next Monday. That facility will have 95 beds. And on the South Coast, we're finishing work this week on a 140-bed field hospital at UMass Dartmouth. This site here at Joint Base Cape Cod, as I said earlier, will house 94 beds and will start taking patients on Monday. The site would not have been possible without the terrific work of the National Guard, Cape Cod Healthcare, MEMA, and the folks in our command center. MEMA procured and coordinated the non-medical build-out of the facility and passed the baton to Falmouth to add medical equipment, supplies, and personnel. The command center's medical surge planning team will provide ongoing support to the hospital, and this site really does represent a terrific partnership between the National Guard and the team to utilize Joint Base Cape Cod. I do want to take a minute to speak a bit about all the National Guard is doing to support our COVID response efforts throughout the Commonwealth. I think many of you know that last week I signed an executive order that increased the number of National Guard personnel who can be activated from 2,000 to 5,000. At this point, we have about 1,500 Guards people that are on active state duty. The order I signed on Friday will allow a more rapid call-up if needed and will allow sick or injured personnel to rotate out without a reduction in force and give the Guard more flexibility with respect to their missions. They have been a crucial component and a big player in our COVID-19 response. General Keefe and his team have been planning for countless missions, some you'd expect and many you wouldn't, but all of them have been done with the excellence and efficiency that the Mass National Guard is known for. Some of the stuff they've been involved in includes erecting screening tents at DOC facilities to protect against introduction of the virus to our state correctional institutions, helping support the building out of our field hospitals, assisting public safety officials in cities and towns transporting and distributing PPE to hospitals, first responders, and partner agencies, conducting daily missions to perform COVID-19 testing at long-term care facilities, which they've done over 3,000 tests at more than 250 locations in the past 2 weeks, working with the Holyoke Soldiers Home, where the National Guard medical and operational teams are working hand in hand with on-site staff to provide meals, medical care, and assistance with daily living to the resident veterans, and a host of other initiatives. And I just can't say how much we appreciate the work the Guard has done. They've stepped up every single time we've asked, and they've been especially terrific this time. Putting this field hospital together at Joint Base Cape Cod is a great step forward for all of us in increasing our capacity in this part of the Commonwealth, and we'll continue to do all we can to make sure that every community in Massachusetts has the resources they need to push back against the virus, especially during this surge period. Now, we know everyone's anxious to talk about how we get back to something like normal, and I can promise you that I am too, and I know the LG and everybody else is as well. And especially on days like this, when I get out to sites like this one, where I know I would normally be shaking hands, maybe giving a few people a hug, a couple of high fives, but obviously there's none of that going on, because everyone is doing the things they need to do to stay distant and to stop the spread. But our data is showing that we have some very difficult days and weeks ahead, and that's precisely why we're here today and planning for what we call the worst case scenario. We certainly hope we don't have to use these beds, or certainly not all of them, but we wanted to have a plan to make sure that we could if we needed to. We've also started to talk with folks about reopening, but we would think at this point in time that we have a lot of work to do before we would put a plan like that into motion. But that is why, in many respects, we launched our first in the nation contact tracing initiative. That's why we're making more and more testing available, because we think at the end of the day, testing, tracing, isolation, quarantine, those are big parts of any legitimate effort and play a major role associated with any attempt to reopen. Because those are the sorts of things that we will need to do and do well and do on a grand scale to give people confidence and comfort that we are safe to get back to work. Part of the planning also requires listening to and learning from our neighboring states. We share a lot of commerce, a lot of travel, and a lot of people with the states that are around us. What we do has an impact on them, what they do has an impact on us, and we want to make sure everybody's aware of what everybody else is thinking about, working on, and planning. And that's why we'll be working with our regional partners going forward. But I do want to make a couple things clear about this. First, our response to this emergency will always put the needs of the people of Massachusetts first. We're going to work collaboratively, and we'll learn from all the experts we can, but we're going to do in the end what's right for Massachusetts and for the people of Massachusetts. Second, reversing course too soon, opening up before we're ready and before we've done some of the things we need to do, that we can do it safely and have a plan in place to make sure that we can monitor, measure, and survey what's going on, will only make matters worse. Everyone's had to put up with an extraordinary amount of grief and, in many cases, a tremendous amount of loss over the course of the past 6 weeks. Taking our foot off the pedal with respect to what we need to do to push back right now on this virus would squander, in many cases, a lot of the progress that we've made. Our hospitals, who we're talking to every day, are managing the influx in new patients. Nobody is rationing anything, but we're still on the upswing in this pandemic. Everybody's done a great job. I can't tell you how proud I am and how grateful I am to be a part of this wonderful community here in the Commonwealth of Massachusetts, where everybody has a part to play, they understand it, and they sign up, and they follow through, and they execute on it, no matter how big or how small it might be. And everybody, as we've said before, needs to continue to stay at home, only leave if you need to do something essential, and if you do leave home, and you can't manage to create distance between yourself and others, if you're concerned about that at all, you should wear some kind of a face covering. If you're going to the grocery store, the pharmacy, or to the doctor's office, or someplace like that, because that's how you protect yourself from others, and it's also how you protect others from you. We know that in many cases there'll be some tough days ahead for our residents, but the way we get through this is by playing by the rules, sticking together, following the advice of our public health officials and others, and recognizing and appreciating that we have a lot of really smart and talented people in the healthcare world here in Massachusetts who can help us get through it as well.